this one little tool will help you get to that next level of volume that you're looking to get to.
Welcome to AMC. I'm Dr. Greg Miller. We're in a series on office evaluation, and today we're going to cover the topic patient flow with Dr. Shannon McMurtry. Let's go ahead and get started.
We're going to talk about a often forgotten way to help your practice with limitations on number of people you can see per hour, limitations on referrals. And this is a technique, this is a thing that the doctors that came before you and I, this is something they did regularly. And I don't see a lot of people using this idea nowadays, or if they use the idea, they don't get the full benefit out of it. This idea is really going to do three things for your office. Number one, it's going to help you see more people per hour, but not sacrifice the quality of care that you provide. And that's very important. It's not just about increasing the numbers of people you can see per hour. It's about doing that, but maintaining that high quality of adjustment. You do not ever want to sacrifice adjustment quality or patient results just for the sake of pushing more people through your clinic per hour. So that's number one. We're going to try to satisfy that need. Number two, this is going to help your office run more efficiently. Efficient running and more people per hour do not always go hand in hand. When I say efficient running, I'm talking about eliminating wasted effort. And I'll get into more of that in here in just a minute, but that's the second thing we're going to accomplish. And then number three is give you a predictable way to have referrals in your office on a regular and ongoing basis. This technique, this secret, this thing, this idea that others used a lot and we don't use a lot much anymore, it's called jump seats. And a jump seat is a very powerful tool in your office. And honestly, if you can have 2 or 3 or 4 jump seats together, you even make that powerful tool more powerful. I'm familiar with a doctor that had a limit in his clinic. He was busy, but he wasn't really maximizing his potential. We moved one chair in that office. We took it from one section of the office, put it in another area in the office, very close to his adjusting room, and that office increased a significant amount of dollars per month. We're talking about 5 figures per month. So you may have heard of jump seats in the past. Maybe you've used them in the past. Perhaps you have them in your own office, but you're really not getting the benefit out of them. So let's explore it a little bit further. A jump seat is simply a station where the patients will come and wait for their treatment room to open up. And it's away from the lobby. It's in the part of the clinic where you're spending most of your time, i.e. the treatment room, the adjustment room. And it's located in a place where you don't need another person to help manage those patients. You can manage those patients as you're bringing people into the adjustment room or dismissing people out of the adjustment room once their adjustments are completed. So we want those jump seats to be in the right place. We want them to be in a place where ideally a 5-foot hallway right there outside of your adjusting rooms between your therapy or rest area and the adjusting rooms. That is the perfect placement for a jump seat. But even if you can't find the perfect place, making use of that tool is, even if it's not optimum, it's still going to pay dividends for you. So let's talk about more people per hour. Psychologically, a doctor will move at a faster pace if they know that there are people waiting on them and that doctor is aware that they're waiting. You know, when they're out in the lobby, you can be kind of in the room, time is standing still, You're with that patient that's in front of you. You're pouring all of your time and attention, all of your heart into that person, and you can sometimes be oblivious to what's happening in the lobby. It's too far away. Well, if after every adjustment you're seeing 2 or 3 people wait in your jump seats, you know that you have people waiting. You can't be oblivious to that anymore. So you will move faster, more efficiently. You'll take that focus that you have and you'll even ramp it up more. Plus, you don't have the wasted effort of going to the front desk and getting the next patient or having the staff escort the patient back to the room. Your room stays busy. There is no idle time. And that's how you increase your patient visits per hour. It's realistic to go from 8 to 12, 16 people per hour to 20, 30 people per hour, depending on your technique and how quickly you move. So, it's going to help you with that patient visit per hour number. And some of you who are capped out on your volume or you're already at max capacity, this one trick, this one little tool will help you get to that next level of volume that you're looking to get to. Secondly, the efficiency standpoint. When you can stand in one place in your office, when your front desk CA can stand in one place in your office and really not have to do a lot of unnecessary walking back and forth, escorting patients from one room to the next, whatever, that in and of itself creates efficiency in the office. Sometimes we get fatigued, we get worn out because we have wasted effort and we have wasted movement. And as you have increasing levels of volume in the clinic, a few seconds here and a few seconds there doesn't seem like a lot, but that adds up over the course of a day. That adds up a lot over the course of the week and over the course of the month. It's amazing what shaving off 7 seconds per patient visit in a busy doctor's office will do for efficiency and for increased volume over the course of a given week. So we create efficiencies in our movement. We create efficiencies with the patient's movement, and that efficiency helps the office run smoother, less stressful, less chaotic, and of course it gives you the ability to see more people as well. Now, lastly, and this is the one that most people do not really understand, they do not make use of. Those jump seats, that's a referral factory for you. You think of it this way. You've got people who are established patients in your clinic. They love you. They love what you do. They've gotten great results. They're happy as maintenance and wellness patients, and they're sitting right beside somebody who's brand new to your clinic. They're getting their first or their second treatment that day. That new patient is still, in kind of a very tender spot with their issues, and they haven't had the full recovery yet. Imagine getting those two people talking. Imagine the established patient who loves you and loves what you do, who has gotten great results, encouraging that person who is new to the clinic. Imagine two people with similar types of issues, headaches or asthma or irritable bowel, whatever it is, and you can actually get them into a conversation with each other. The person who's gotten great results shares their good news, shares what you did, shares the true story of chiropractic with this new patient in the clinic. Doing that, creating those conversations, leads to referrals. Why? This person, this patient, this new person to your clinic is hearing about your value and what you do and the results you get from another person. They're not hearing about it from you. And it kind of hits them in a different place. It hits them better than when you're bragging about the results that you get. You're amazing. You get great results, but sometimes we're not comfortable bragging about those results to other people. So you get a patient to share those results. You can have people in the jump seats talk about their condition that's different from each other, and that will spark referrals as well. You get a headache patient in one chair and an asthmatic patient in the other, and they're talking and sharing their stories and sharing their results. Well, guess what happens? The headache patient says, well, I never thought chiropractic could help asthma. My son has asthma. That patient is going to bring that son in for a checkup. And it's not because of chiropractic being so good or your education being so good or your adjustments being so good. It's because that they heard a story of another person that they related that condition with somebody in their family in need of care. This is the underutilized section of the jump seats. If you're going to use the jump seats to help you with your volume, if you're going to use the jump seats to help you with your efficiency, please use the jump seats to help you find other people in need. Every day you wake up, there's somebody in your town waking up with a new health condition that they never had before. And they're worried and they're concerned and they don't know what to do. Furthermore, you have people waking up this day just like you, but they're at the end of their rope with their condition. They've done everything that they were supposed to do. They've seen all the doctors that they were supposed to see. They're not getting results. They're losing hope. They're losing optimism. They're losing the God-given potential that they have in them. And that's something that you have to realize. So this pursuit of referrals is not just about growing your clinic. This pursuit of referrals is about doing what you are called to do, and that's serve people through the wonderful chiropractic care that you provide. There's a lot more on jump seats, as far as logistics and, pictures to hang and what you want them looking at and, how to manage those seats as you see patients and in between patients, how you direct people. We don't have time to cover all of those details today, but those details are important. But keep in mind, if you're at a point where your office needs to take a bump up in that patient visit volume, you've been maxed out at a pretty good clip, but you could do better. You need to create some efficiencies and not wear out your team, or you need to make sure that you're getting more referrals in that office. Take a look at those jump seats. It's a very powerful tool. It's worked in the past. It will work today. I hope this has helped you, and I hope to see you on the next video.
I'm Dr. Lindsay Johnston. Jump seats have made a huge change in my practice. Having the patient there ready to come in the room has decreased the time that I'm waiting to get them, but also breaks their waiting time up by having the staff move them to the jump seat. Kind of lessens the time that they think that they're in the office, keeping that constant motion. It also increases referrals, having a couple patients there as well as the staff there, condition of the week board there. It is an easy conversation piece to not only engage that patient in that area of the office, but help lead the patient into a referral.
Thanks for joining us today. As a reminder, we've got regular webinars that go into even more detail on this topic. Check the description for more ways to get our content and sign up. If you'd like more information about AMC and how it might help your practice, you can always reach out to us at amcfamily.com.